Um, this is the last of our group from the College of Health Sciences and Human Services. This is Barbara Du Bois, who's in dental hygiene, so she's here to talk to you about that program. Sorry, I did that. And then especially some of the interesting things to have with your clinical side. I think that's really an important service for the community, so I know she'll talk about that. I'm going to switch off this very front row.
Okay. First of all, is anybody interested in going into dental hygiene in here? Nope, I didn't think so. So what we're going to talk about is all of you have had your teeth cleaned at some point in time, right? Gone to the dental office, and usually you're all young, you're all healthy. So in the dental office, when you have your teeth cleaned, it's no big deal, right? You're in and out in under 50 minutes usually, okay? We do a lot of MSU students over in the dental hygiene clinic. And the first thing I want to tell you is all treatments are at no charge for you guys. So, you know, we can do x-rays, we do a cleaning, we can place Pitt and Fisher sealants, and we don't charge anything. You don't pay a fee when you register. Like to utilize Vincent, you pay a fee every semester with your registration. With the dental hygiene department, you don't. When we say it's free, it is free. And so even if you're not that interested, let your parents know, because then your parents will appreciate if they're having to, you know, fork out the money to go into a dental office to have your annual or biannual checkup. You can have it done here on the MSU campus in Centennial Hall at no charge, okay? Now, we're a Bachelor of Science in Dental Hygiene degree. It's an entry-level degree. There are only 3 programs in the state of Texas that offer an entry-level Bachelor of Science degree in dental hygiene. The rest of them offer associate degrees, and then you go back and you take other courses and you get a degree, not specifically in dental hygiene, but one like Bachelor of BAAS, things like that, okay? The reason the Bachelor of Science in dental hygiene is good, because if you went into the dental hygiene program, you got a degree, you got out, you could automatically teach in some of the associate degree programs. You could also go into public health, get a public health position right away because of that bachelor's degree. If you wanted to go into dental product sales or pharmaceutical sales, you have to have a bachelor's degree. Now, with that bachelor's degree, if you felt like, okay, you wanted to do something like that, then you'd also have to take some other courses that would be like in marketing or something like that if you're thinking about going that way. Now, what I say here is, if you're interested in the healthcare field, okay, that can really make a difference in somebody's life, you can really make a change, this is the way to go, because it's a healthcare field that you don't have to work nights, weekends, or holidays. In the dental profession, normally your work week is Monday through Thursday. It's kind of been standard, but you can work as much as you want. You can work 4 days, you can work 5 days, you can work 6 days. You can work 1 day if you want. A lot of times people will work in different offices because they like the variety. If we talk about the salary of a dental hygienist, I usually hit this first before we get into anything else, because then that piques your interest and maybe you'll kind of start leaning toward dental hygiene. The average pay varies from state to state. In Washington, D.C., the average is about $90,000 a year. And remember that $90,000 a year, most of the time you're working just 4 days a week, okay? This is about 30 grand above the overall national average. In Alabama, you don't want to go to work in Alabama if you're a dental hygienist, because their average is about $39,000 a year. Now in Texas, it's about $50,000 to $88,000. And it comes up to about $27 to $44 per hour. And the reason you're concerned about the hours is because in a lot of positions, you're paid by the hour depending upon if you're full-time, part-time, or even if you just want a temp. So full-time would be 4 days a week in an office. A lot of times we have individuals that will work 2 days in one office, 2 days in another office. Or they temp. There are temping agencies in some of the larger cities, and you register with them, and then you tell them, okay, I only want to work Mondays and Wednesdays, or I'm available to work Monday through Friday. Okay, if you work for a corporate office, the corporate offices a lot of times are also open on Saturday. So you could work 1 day a week, or you could work 6 days a week, and that's going to depend, what your overall salary is going to be. And that is based primarily on, this per hour, how many hours you want to work. There are some offices that you will be paid by the hour, some paid by a salary. and others paid by the hour plus commission. And so there's a lot of different ways that you can go with this. If you look at RDHs, the registered RDHs that work full-time, we've got about 66% nationwide. And of that 66%, that means, you know, working full-time, 4 days a week, about 54% are at one job. And then the remaining 12% are working at multiple offices. You got about 33% that work part-time. Of these individuals, about 21% work one part-time job, and then the other 12% work multiple, okay? And you can also just sub. You don't have to go with a temping agency. If you live like in Wichita Falls, you let people know. There's no temp agency here, but you can let various offices know, and a lot of times it's word of mouth. If somebody's going on vacation, you can fill in for a week. You can fill in for 2 weeks. If they're going on maternity leave, you can fill in. And a lot of times what we say, if you fill in for somebody on maternity leave, chances are real good that you're going to end up with a full-time position, because once they have that baby, a lot of times they don't want to come back. They want to stay home. So I think dental hygiene is a great profession to go into, particularly if later on you have family and, you know, you don't want to work full-time. We have graduates that we had a young man that is a farmer up in Oklahoma. And so he farms and he does dental hygiene. We've got another young man that is a soccer coach for, I can't remember, it's a pretty big school down in the Dallas area. And so he coaches soccer, and then he also does dental hygiene on the side. We've got a grad that teaches school during the fall and the spring, and then when she's out in the summer, she does dental hygiene. We have dental hygiene students or grads that have gone on to dental school. And if you're thinking, is anybody thinking dental school here? If you think dental school, I would highly suggest that you go through a dental hygiene program first, because then you learn how to use your hands, you learn the anatomy and all of that. It's just easier than to slide into dental school. Whoops. I don't want to go back down there. Okay. Now, just to give you an idea of if you were to apply to a dental hygiene program like MSU, or pretty much it's the same all across the state, all across all the states, okay? You have to be admitted to the university, and being admitted to the university, like to MSU here, doesn't mean that you're automatically admitted into the dental hygiene program. You have to complete a separate dental hygiene application. And that application, we have to have copies of transcripts from all the colleges that you've attended, because we look at all of the grades. We have 55 hours of prerequisites that you have to take before you get into dental hygiene, because then in dental hygiene, you pretty much are working 7:30 to 5:30 Monday through Thursday, okay? So it's real difficult to take any of your other prerequisite courses once you actually get in the program. So we have to have those copies, because we're going to look. And if, say, you decide you want to go that route, and there are 5 science prerequisites that you pretty much have to have for all dental hygiene programs, if it takes you 3 times to get a B in your science courses, then we're going to our advisors are going to say, man, you may want to think about something else, because, you know, there are those of us that are extremely excellent at all of the other prerequisites, but when you get down to the science and the math, you know, that's just not our forte, and we have a hard time. Once you get into the program, the first semester is actually 19 hours, and all of that is going to be science-based. You also have to take the TEAS 5 test, and what that is that it's a test for allied health, and it's got math, it's got English, reading, you know, comprehension and that, and we don't require the math section, because thankfully dental hygienists don't have to do a lot of math, okay? And so we require the reading and then an English and language usage sections. And you have to earn a minimum of a 63. Those are actually make up 5 sections, and you have to have that 63 average, because what we found is that over the years, if you have someone come in and they're extremely low, they're in the 50s, then they have a hard time doing all the reading, okay, and carrying all the hours. And you can go through the 2 years in the dental hygiene program. You can graduate with a Bachelor of Science in dental hygiene, but you may never get to practice if you can't pass the licensing exams. Your fourth semester or your last semester in dental hygiene, you take a national board exam, which is basically a 6 to 8 hour written exam. And then you also have to take clinical exam, which you have to present a patient, you work on that patient, and then they're evaluated. We talk about the written exam, you pay $460 for that. You have to pass the national board in any state in order to get a license or apply for a license to practice dental hygiene. Then there's the REB, and REB is one of several clinical exams that are offered across the country. The REB is good for, I think, like 15 states now. The REB is basically $1,200 that you have to pay just to sit for that exam. You have to pass a clinical exam in order to get a license to practice. So you can graduate from a program, but if you can never pass those 2 exams, you can't ever do anything with your dental hygiene, okay, with your degree, because it's not going to let you apply for a license. We also want you to have 20 hours of observation or dental office experience. The 20 hours that we want you in there is not you as a patient, because we want you there kind of shadowing the dental office so you get a feel for what it feels like on the other side of the chair. Because it takes a lot of blood, sweat, and tears to get into the dental hygiene program. And you think you're done, everything's relaxed, you're ready to go, and then you figure out it takes more blood, sweat, and tears to get through those 2 years in dental hygiene. And so you commit a lot of effort, and there's extra money that you have to dish out for instruments and things that you want to make sure that that's really where you want to go, okay, and what you want to do. We have had individuals in the past that, mid of the first semester, they said, no, this is not what I want to do. We've had them second semester, middle of the semester, where they're actually working on people, and all of a sudden they decide, I don't want to work in these dirty mouths. This is not what I want to do. And it's like, okay, this is what you do every day. And so they dropped out. So that's why we require the observation, just so you get a good idea. And then you also have to have 3.0 GPA. And what we do is we look at the cumulative, you have to have those 55 hours of prerequisites. We look at the cumulative GPA of those 55 hours, and you get ranked based on where you fall. And then we look at the science GPAs. So once we get that, what happens is your application packet is received by the dental hygiene department. The admissions committee looks at it and ranks it based on the number of prerequisite courses completed with the final grade of B or better. Now, obviously, our deadline is April the 1st. So that's the spring semester. There will be students or candidates seeking admission that will still have courses in progress. And so they get 1 ranking point for each one they have in progress. Now, what you want to make sure that you do is those 4 or 5 courses you have in progress are not your science courses, because for each science course that you get a B or better, you get 3 ranking points. Well, if you're taking these science courses and they're in progress, you only get 1 ranking point. So it's real critical that, if you ever decide, if I can talk you into tell you, how great dental hygiene is, that you work with our advisors. And so the number that are completed, you get points, and then your science and cumulative GPAs, your TEAS test, you can get either 1 or 2 points for that. Number of courses you have in progress, your dental office experience, and how you complete your application. And it says it's not a complicated application, but it's like type in one part, handprint in another part. And so the admissions committee looks to see how well you can, follow direction. Gives you a little space to put something. You're supposed to put it right in that little space. And if you attach 3 other pages that you've got there because, you're saying how much you love dental hygiene, you love teeth, you've always loved teeth, et cetera, you're not going to get the points because you didn't follow the directions. Tiny little space, put why you want to be dental hygiene. The top 18 then are offered a position in the entering class. Now, we have an average of about 30 to 40 applicants for the 18 positions. The other schools were much lower than what other schools across the state have, because they may have as many as 200 or 300 apps, but the reason is they take an applicant, they let people apply right out of high school. Our application packet specifies you got to have at least 50 hours of these prerequisites, and then the other hours in progress. So a lot of times what that does, you have to really know that you want to be in dental hygiene, okay? So we're in the Centennial Hall, which we know where that is, where the horses are. And we provide one-on-one patient treatment, okay? And all our clinicals are done right over there in Centennial Hall in the Gaines Dental Hygiene Clinic. And so today we're going to talk a little bit about the clinical aspect, the radiology, and the lab portion of, some of the job responsibilities that we do. Okay, when you come into Centennial Hall, this is the big glass front there. You come around the elevators and there's a sign here that obviously indicates where we are. You're going to go into a room, which is our reception area, okay? From there, this is a dental hygiene clinic. We've got 18 ops, okay? And each one of the ops look like this. So that's why we accept 18 students. Each student gets an op, okay? And you're working in that op. Now, usually I like to switch so that you're not in the same op for the entire 2 years, because then you just get a little too secure. Every semester I move them, because when you go out and practice, that's a brand new op for you there. So you're used to kind of moving around a little bit. So what do we do in dental hygiene then? Let's start by radiology, okay? These are intraoral films here where all of you've had bite wings, right? If you've gone to the dentist, they usually will take 2 films on each side or 1 film on each side. How many of you have had the pan where it just is a machine that goes all the way around? Okay. So we take or expose those, and it used to be we would process them by hand. They were wet films, but now over, in our clinic, it's all digital, okay? All right, so let's look at some intraoral films. This is the machine that you use, and these are bite wings, typical bite wings, 1 on each side or 2 on each side. You can do a full set that looks something like this. And you can see down here, these are the bite wings, these 2. So for some people, you only do 2 bite wings. Some of them you'll do 4 bite wings. Others you'll do a full set of what we call periapicals, or these individual films that the full set can be anywhere from 18 to 21 films. And in this, we take these because we're looking at a lot of different things. One is we're looking for active decay, which will show up darker. 2, we also need to know where all the restorations are in the oral cavity, because when we take an instrument and we're sliding a sharp instrument down here, I need to make sure that there's not a cavity there, because I'll be instrumenting that surface. And basically, if it's a cavity, I remove calculus, and then I end up doing a cavity prep. I remove all of the decayed material, and we don't want to do that, because then that's probably going to make you sensitive. But if you look over here, what you've got, these are those silver fillings that we call amalgams. You go here, and this is going to be a crown. You look here, and we've got a furcation involvement starting under this crown. So when we do instrumentation on this area, we've got to make sure that we come around and we get into this furcation. What happens on the top teeth is you've got roots that look like this. And so if you've got a crown that's fitting like this, and you've got a furcation is where you've already got bone loss down here. So you can actually go into that furcation involvement. And so we have to make sure it's clean, and we have to make sure that the patient understands that that's an area they've got to keep clean, because it's only going to get worse. To where we have patients that come in that you can take an instrument in. Here's the tooth, got bone loss all around here. And you can take your instrument in and do something like this all around the roots. Some of these are going to be covered with gingival tissue or gum tissue. Others, the gum tissue is receded down so that you can actually see what's there and what you're going in to get off. Here's another one, and you can see somebody spent a lot of time in a dental chair here, right? If you look across, first thing I look at is one, okay, we've got a lot of restorations. When I go in and I scale, I need to be aware of where all of these are, because if there happened to be calculus right here, I would need to remove the calculus, but I would have to remove it without damaging the margin of the crown that's sitting there. And so I look at that, I look here, and you can see these fine white lines that go there. That tells me this particular tooth has had a root canal. They've had to go in and remove the nerve. And then it looks like they've just done a silver filling or an amalgam here. But on this one, they've got a crown. And if you look across here, see how that stretches all the way across? That's kind of like an image from the x-rays, because if you look over, it's not, they're not connected. You look here and we've got a separation. It's just their angulation that they came in here. But you can see on the maxillary teeth, you've got 3 roots. And with the way the beam is going in here, you only see the 2 roots from this position. But you look here, you can see you've got all three roots. They'll go in, they'll remove those roots, they'll put in something called gutta percha, which is almost kind of like a little tiny straw that is made out of paper. And it's really compressed paper. And after they go in and they ream out these roots, they'll pack it with this paper. And then normally what happens is they'll do a restoration over that. Or if it is too large, say this tooth probably had a humongous area of decay on it. And so they had to do the root canal because the tooth is dying and it's going to be uncomfortable. And once you do that, the tooth gets real fragile over a number of years. So you usually have to put a crown on it. And so the crown sits down on it. So what we're looking at in this area is I'm looking to make sure that there's no decay here. I'm looking to make sure sometimes if they don't get these all the way down and they don't remove the root or the nerve all the way, you'll see an abscess. You'll start to see infection that will accumulate down here and it'll hurt. Or you'll have those folks that will have an abscess, but what's happened is that infection has tunneled its way through the bone. And you look, when you're looking in and there's kind of like a little bump on the inside, that's where the infection has kind of gone out. And so there's not any pressure that's building there. And so it's not uncomfortable for them. But you take that and you push it and you'll see that exudate coming out. And it may get larger. And then just by mastication, eating, that may bump it. And so it expresses that exudate. And so they can go along with these abscesses and not have any idea that they have a problem. I also look here. This is the lower border of the sinus. So if you're looking here, looking how low this border is here, if an individual came in and they were complaining of a toothache up there. Now, obviously, we're going to look here because it's had a root canal. There shouldn't be any feeling up there. But if there wasn't a root canal up here and the sinus border is right down here, then any kind of sinus infection you have could be affecting the teeth. So then you have to think about that. Also, with this so low, if they did have an abscess here, that's going to seep into the sinuses. And again, we're going to have a major problem there. If you look across here, these aren't root canals per se, but these are post. I would say this individual had so much decay or maybe had the teeth broken off for whatever reason in this area that there wasn't enough tooth left to put a crown on. Because you've got a tooth and you'll post it out and then you'll put the crown on it and it's cemented on. They didn't have enough support to do that. So they have to go in and they have to drill a hole and put a post in, seat that post, and then they put the crown on over it. Now, if you look at this is a panoramic or a Ceph film, and this is what they look like. We take those, and with this, we're looking here, the eye sockets, septum of the nose. Look how low the sinus floor is here. TMJ is up here. So you're just kind of looking here. This is good to see not so much bone height around the teeth, but if you've got any pathology that's going on. If you've got a big cyst down here, or if you've got a large abscess coming down, I would look here and here. You think, okay, that's dark there. That's probably an abscess. But no, those are foramen. Those are holes that the nerves pass through. Now, the next one is going to be a child. And I'd say this child is probably maybe 8 years old. And you can look at this because what's happening is these are all the permanent teeth up here that have not yet erupted into the oral cavity. What we've got here, these are permanent teeth because look how long the roots are compared to these. These roots are still forming, all right? This here is a permanent molar. These two are your first permanent molars, or the first permanent molars that you get into the oral cavity, and they're called the 6-year molars. So they come in when you're about 6 years of age. These back here are your 12-year molars, and they'll come in right around 12 years of age. Technically, this is your first molar, this is your second molar, your wisdom teeth would be your third molar. But this tells me here, this is bone, And there's tissue covering all of this. So this is not erupted into the oral cavity. And you can see here, the root is not formed. So this particular child is nowhere near 12 years old. But yet I know that they're older than 6 because they've got their 6-year molar. And these anterior teeth, these 4 lower and these 4 upper, they're already permanent, and they come in when they're roughly 7 to 8 years of age. So I would say that this child is maybe 8 years old. Okay, now if you do forensic odontomy, they'll also take films like this, and they'll take them, and if they've got a body that they can't identify, and that's a field that you could go into also, is they'll look at the teeth, and they'll have to match the teeth, which is why it's critical whenever you go in for an dental office visit, that they chart your teeth. And they chart it correctly, because God forbid something ever happens and you have to be identified by your dentition only. They're going to go back to that office, your last visit, and they're going to compare whatever teeth they have with your x-rays and the charting that's there to try to determine if this is in fact this individual that they're looking at. We also use it to help us identify, not only where the restorations and things are, but calculus. Look right here. This is calculus. Now, calculus is a mineralized deposit. You can have it above the gum line. You can have it below the gum line. If it's below the gum line, you can't get it off yourself. Depending on how hard it is above the gum line, you can't get it off either unless you take, some instrument, or people have told us they've taken pliers or screwdrivers, things like that. They try to go in and get this stuff off. We've had people tell us they brush their teeth with Ajax. That's why their teeth are so wide. But you're looking here, it's mineralizing. Now, it is not as hard as the enamel of the teeth, so that's not why it's not so opaque here. The longer it stays, the easier it's going to be able for you to see it, and then the more difficult it's going to be to get it off. So you can kind of see here. So what we're doing when we look at these is we're trying to also determine how much calculus is there. What kind of instrumentation are we going to have to do? We also are going to go in with what we call an explorer, and we feel all these areas to try to determine what are we dealing with. Besides, radiographs, looking at the radiographs, we also do extraoral and intraoral exams. So this is why a lot of times people think, well, as a hygienist, you only have to worry about this hole here and the teeth that are inside the oral cavity. But what we know is the mouth is the gateway to the rest of the body. And there are a lot of systemic problems, systemic diseases, that the first clinical signs and symptoms will appear in the oral cavity. Leukemia. Leukemia is a classic one where someone can present in and their tissues are fiery red, they're edematous, they're swollen. And if these individuals don't have calculus, they don't have a lot of biofilm or plaque, then you're going to be looking, okay, I'm going to do a cleaning. We're going to get you back, and we're going to look to see if this has improved any. And if it hasn't improved and you can't find any other local irritants, then you're going to start to evaluate systemic things. Could be hormonal. A lot of times with pregnant patients that come in, a lot of hormonal changes, and you'll see a lot of gingivitis, a lot of inflammation in bulbous tissue because of that. So we do that. We also palpate the lymph nodes that are here. Hygienists have to know what all these lymph nodes are, what they feel like normally. You shouldn't be able to feel them if they're normal. But if you get any kind of swelling, then you have to determine, is it bilateral? Is it on both sides? Is that not movable? Is that not tender? If you've got a knot and it's tender, that usually means, okay, you've got some type of subclinical infection. But if you've got a knot that's only on one side and it's not tender, then we're going to be concerned. We also palpate the thyroid to make sure we don't have an enlarged thyroid. So there's a lot of different things that we're looking at. A lot of patients think this is the best part of the appointment, because particularly you go back here to do the occipital nodes and things. And so you basically get a neck rub right before you get started. So let's do some clinical instrumentation. Let's go in the mouth then. This is what takes the full 2 years, okay, of education and training, because you have to teach your hands and your fingers they're relearning movements. And it's not until you actually have to go through the first semester that you think, how hard can this be? You know, I was an assistant before I became a dental hygienist, and, you know, I'm going in thinking, okay, this will be no big deal. But to get your fingers and your hands to do what they're supposed to do takes a full semester. Just to be able to do that by hand, and you're working on mannequins, and then you're victimizing each other. And then we turn you loose on unsuspecting people, okay, the next semester. If you look here, we have always worn a lot of PPE, but we've kind of doubled it since COVID. This individual has an N95 mask on, like what I've got here, but then we make them wear a level 1 mask over that. So they're working with 2 masks. They've got glasses, safety glasses that have the loops, the magnifiers. They're wearing that. They now have to wear a shield. They have to wear that wonderful blue bouffant cap, the overdowns, the gloves. They have to use extra oral suction, because if you look at it, the #1 profession that has the greatest risk for infection and sickness out of all of them, out of your nurses, your surgeons, doctors, for dental hygienists. Unfortunately, we rank right at the top, okay, of high risk. And the reason is because everything we do and create an aerosol. And so we can't maintain a 6-foot distance. We're working 12 inches to 18 inches from an open mouth. We're in there with powered scalers that you've got all this mist that's coming around. So you have to catch that. And so she's doing it by hand here, but over here we have what we call high volume suction. So if she starts to use the powered scalers, that suction has to be right there. So whatever aerosol is created, she can suck it up right there. Now, this is probably what most of your teeth look like. And this is why when you go out, you know, and have your teeth cleaned, it's real easy. Tissue is nice and pink. You can see the knife edged margins of your gum line or your gingival margin. The papilla that come down here, nice and healthy. You can go from this to we see a lot of this. And you see the difference here. Now we've kind of got rolled gingival margins. Do you see the redness that's here? Okay, this is infection. To where I'd like to usually, I didn't put the picture in, but a lot of people don't associate gingivitis or gingival infection with really being, you know, a problem. And the reason for that is because your mouth is wet all the time. And it's kind of like, if you ever had chapped lips that they hurt and you keep wetting them, right, to make them more comfortable. And as you keep wetting them, it makes it worse, but you're more comfortable doing that. That's what happens in terms of oral diseases can sneak up on you because it's a wet environment and you're kind of lubricating that all the time and you don't realize how severe it is. You can go from here to here. Now you're not going to go overnight. You can go from here to here in as little as 14 days. If you stop brushing, if you've got the right microorganisms in the oral cavity, okay, you can go to there. Or after several years, you can go to something like this. Now, do we have any weak stomachs in here? Because we're going to kind of get into some stuff I think is just wonderful, but some of you might think it's kind of gross. So these are the kind of patients that come in that you'll find the faculty is hovering around the student because the faculty is like, okay, why don't you just let me show you, you know, so they can do it. They want to get in there. These, you know, these are the kind of mouths we live for, actually, okay? Look here and look at the color. This is a more chronic infection. Do you see all of this under here and how it's rolled? That tells me this is hard. This is calculus. Calculus that is now, we call it black serum calculus because it turns this dark color because it picks up pigments from the blood. And this has been there for quite a while. If you look down here, we've got calculus that's pretty mineralized up here. We've got calculus down here that probably has biofilm or soft deposit over it. And if you look how far it extends down, when we take this off, you're going to see down in this area that the tissue has tried to crawl away from the calculus and it is going to be bleeding, it's going to be uncomfortable for this particular patient. So let me show you with this, you can see a little bit of inflammation. Let's hope this opens. This is the type of cleaning that most of you probably undergo when you go into your dental office.
You want to know why
Not
running
that.
on the treadmill 7 days a week doesn't work for you when you're trying to lose weight? You want to know why running on the
Because it
treadmill
never
7 days a
happens.
week doesn't work for you when you're trying to lose weight?
You go up to
Let's
a
skip
Because it
that.
never has. And I know that's hard to believe, but it's
I'll go with
true.
2 of them.
Cardio actually burns calories, usually in the form of carbs in the bloodstream that are then.
Yeah,
Got
I'm
a
not-
friend
I'm not-
from my mirror. I need to wipe.
Is this what your cleanings have kind of felt like? They've gone in with this hand instrument, they go through, you hardly have anything,
Then I'll
you
head
can
over to
breeze
the
through
gloves.
usually, and then they get to the polishing. That little
I
rubber
like to use
cup
the
that
mirror for a
polishes,
little
and everybody
extra
likes the
illumination.
polishing.
Over here, you can also use an extra raw fulcrum if you can't access those areas.
Huh?
And coming down to the lower.
Is she what? No. Mm-mm. This is nothing. I mean, she's staying pretty much barely going below the gingival margin. This is what, pretty easy in and out. But the problem is, if you have to hold the instrument a certain way, and then you have to have a fulcrum somewhere, because when you make your strokes, you can't go like this. Because if you do like this, and there's a big chunk of calculus, it's tenacious, and you try to pull it off like this, once you pop it off, you're gonna slip. You're gonna come out, you're gonna maybe slice the side of their mouth, or you'll slice your finger. So you have to be able to figure out, you hold it, and then you have to move like this. Okay, no digitizing, as we call it. So this is a pretty easy. Okay. So now let's go here. What happens with this type of a patient? This is before here. This is another patient, but what you're going to see is the back of these teeth are going to look like this. All right. So how do we go from here to here? This is right after treatment. And you can see the tissues are really inflamed. No matter what you do, you're going to get bleeding. Same thing over here, but you see how we've got all of this removed here. So how are we going to do this? You can go in. Let's see what kind of advertisement we'll see first. I've got 2 open again. Okay. You see how hard they're having to pull? Because that's calculus that's real tenacious and it's hard, okay? So you're pulling it out. And to be able to do that, you have to make that short stroke. You can't make a long one because you don't want to slip off of the tube. And so you're looking, you can do it like this, where you do it by hand. Am I losing anybody yet? I figured it was before lunch, so you guys would be okay. Okay. So let's go now. We have powered scalers. So let's show you. And then I've actually got a film from a patient we worked on. Why is it over there? It's running music. Okay. This is a powered scaler going on the lingual or the tongue side of your lower teeth there. And you can see the calculus that's built up there. You have to go in, and what that is that powered scaler moves. It's a 30K. So that means it moves 30,000 times a second. Now, you're not going to see, you can't hold it up and see it, but you can put your fingers on it and you feel it vibrating. You have to have the water because that tip is moving so fast that it is going to heat up. And so the water is there to basically keep this metal tip cool, but this is what creates a tremendous amount of aerosol there. So you can see what we've got, how you're working there with the ultrasonic scaler then. Okay.
What is that stuff on the back of their teeth? Like little.
The yellow things that are.
Yeah, it looks like little crumbs or whatever.
That's calculus. That's soft deposit that hasn't been brushed off, and the mineral content in the saliva will get into that and it'll start to mineralize it. So So if you pull that off, and a lot of times we'll let patients do this, and that gets them motivated to come back to finish the appointment because it feels like rocks. There's no way your toothbrush is going to get that off. You have to have someone remove it. And that's going to be below the gum line, so there's no way they could get in there. Now, smoking, if any of you smoke, I wanted you to show you what the back of your teeth, you get harped on about, okay, smoking is bad for your lungs, cancer. Smoking, we have to think of oral cancer, significant rise in oral cancer. And what happens with that is we've got a lot of calculus, and we've got the nicotine stain that goes with it. But you also have to worry about the heat when you're inhaling. That heat damages oral tissues also. Vaping is going to damage oral tissues, okay? Now, this particular one, this is a patient we worked on this week, okay? No. I do not know why that's worked over there. This is the best one yet, though. I really want you guys to be able to see this. You kind of see here, we've got 2 hygienists that are working on him. This is the front of the mandibular teeth. You can see it a little bit better there. This is calculus. This is her lower lip. And you see here, this is hard and it's coming off. We're using a powered scaler to take that off. We want to use a powered scaler and not hand instruments. You can do this with hand, but with hand instruments in this type of deposit, you're at a greater risk for slipping. And the primary concern for slipping is your safety as a hygienist. We don't want to slip and slice your finger, because now we have to worry about a lot of different diseases that are out there. I do not know why that's not working. Okay, next thing is lab work. We do some lab work also. Now this is a pre-COVID. This is one of our seniors working on another senior. And what they do is they actually can take impressions, and they pour study models that look like this. And from this, normally what happens is this is how they make mouth guards and bleaching trays, so that they'll put the upper or the lower cast or model on a vacuum former. It's got a piece of plastic up here. It heats up, you push it down, and it comes out a square piece of plastic with this poking up in the middle. So you have to go in and you trim all this around. And so you end up with kind of like a shell of your teeth. And then what happens is you can either fill that with the bleaching material, and they take that home and they use it. Or if you have oral cancer patients or cancer patients in general that are going to go chemo or radiology or x-ray or radiation therapy, they need to come into the dental office at least 2 to 3 weeks before they start treatment, because what happens is they're going to be extremely susceptible to decay. Then they're going to have some type of oral problems, oral mucositis. And the reason is not because, say, the chemo damages the teeth or the radiation damages the teeth. It damages the salivary ducts. And so you're not producing saliva. Your mouth is dry. If your mouth is dry, you don't have any protective mechanism, any minerals coming from the saliva to help you counterbalance the acid, okay, that is you're introducing into your mouth the whole time. And then, you've got something like this in terms of like bleaching, the differences between the two. We do sealants. We do sealants on you. It used to be sealants they thought were only for little kids. College students are prime for sealants because you are away from home. You're having to take care of yourself now. The beer and the pizza every night, it does damage to your teeth. And so those of you that have never had a problem with decay, we see a lot of college students come in and now they start to get sticky areas everywhere. And so what we'll do is we'll place a sealant, which you can see the grooves and things that are here. Those are real susceptible. Those are so narrow at the bottom that one bristle of your toothbrush is not going to get down there where you need to go. But the microorganisms in your mouth can get down there. you feed the microorganisms with whatever you eat, you can't remove that. It seeps down, and they're like, you know, on a Caribbean vacation down there. They're eating the food you introduced, then they're eating the tooth surface too. So what you do is you place a coating, and basically we are occluding or blocking those areas. Now, it's not something that you just take and you just paint it on. There's a series of things that you have to go through. You have to condition the tooth. You have to make sure it's really, really dry. You have to place a sealant material, then you cure it, okay, with a particular light so that you've got that. So what I want to tell you then, even if you're not interested in dental hygiene, okay, you need to make sure that you come over and make an appointment with us and have your teeth cleaned. You don't want to wait till you get to this point where you've got to have somebody come in and do the drill thing, all right? And if I've talked you into dental hygiene, if I've grossed you out enough that you think, okay, dental hygienists need to be nitpicky people, the kind of people that like to pick at things. So if you're a picker, think about dental hygiene. Think about Monday through Thursday work schedule, $44 an hour, no holidays, no weekends, no nights, unless you wanted to do that. So if you think that you might be interested, make sure that you contact one of the health science academic advisors. And for dental hygiene particularly, it's going to be Catherine Rudy. All right. Let's see where I went. And that's it. Didn't gross you out enough. Uh-huh.
So two questions. One, is the PPE that you guys use just enough, or do you do any COVID testing before you treat your patients?
No, we had a patient. When the patients come in now, we take their temperature, we ask them the questions, they have to fill it out. And we had a patient that came in on a Thursday a couple of weeks ago. And he called us back on Monday and said he tested positive for COVID because he gets tested every Tuesday at work. And so we're like there, and I'm thinking, okay, crap. And I knew that we had enough PPE, but the difference was the student and I worked on this patient for 3 hours, and we worked this far from the patient. And so we were advised for us not to get tested for at least another couple of days, because it takes a few days to convert to show up positive. And then they were saying, don't quarantine unless you start to see symptoms. And so she went ahead and got tested. We found out on Monday. She waited till Wednesday or Thursday, got tested, and she tested negative. So that tells us that the PPE that we're using is effective.
Okay. One
Okay.
more question. With the teeth whitening, is that
The teeth whitening,
you guys do it here, right?
we don't have the where we make the bleaching trays or anything, but we sell white strips, which is like the Crest white strips. You can buy that at Walmart and stuff, but you can't buy the strength that we have at Walmart. So I think it's a fundraiser for the students. It's $35 a box, and you can put that, you use those and you'll get some shades of whitening, depending upon how much you want to get and what you're looking at. If you have any restorations on the front of your teeth, you don't want to use it, because the restorations will stay the same color and your teeth will lighten. And so if they matched, say, a crown or what we call a tooth colored filling with your teeth, and then you whiten everything all around it, then that's going to kind of like jump out at you. Okay. So, but yeah, make an appointment, come over, get your teeth cleaned. We only have 2 more weeks of clinic this semester, but next semester, as soon as school starts, probably first part of February, we'll start seeing patients again.
Thank you so much. I don't know that I've seen any of our presentations quite affect everybody the same way. And I know that that's not always a great thing, but it's definitely left everybody with a really remembering.
Okay.
So
yeah.
thanks so much.
My thought was to gross you all out. So if you don't pick dental hygiene, at least you'll remember dental hygiene.
You remember dental hygiene.
Thank you all
Thanks so
very
much.
much.
So just in the 5 minutes that we haven't had a lot of chance to talk as a class. I just wanted to have a quick reconnect with you all on what's kind of coming up. So I know that having these presentations every week has been kind of not passive, but it has been sort of like we're hearing them, but really the end goal is going to be one more reflective essay that's due the week of Thanksgiving. But what I'm going to do is I won't have class on the Monday of Thanksgiving week. And so we won't have class, so you'll have a deadline for an assignment, but you won't actually have to be here, okay? So just to let you know. So that means the last time I will see you guys face-to-face is gonna be the week of the, through the 20th, 16th to the 20th, okay? Now that is the week that we're scheduled to have your campus improvement proposals listened to by people who are from the campus. So that has been sort of the goal, is to have that presentation, having a chance for people to hear about them. I know Dr. Garrison has been incredibly busy with the election, and so he hasn't had the chance to kind of reach out to everybody, and we haven't had the time here. But we want to continue to work on your campus improvement project, because basically there are 3 more things that I ask of you guys. The first is that essay, third essay. The second is your campus improvement project, which we're going to present, like I said, to the group of people who might have influence in making that possible on campus, and also try to do a virtual symposium for the honors program in general. Okay, so those are the 2 components of that presentation. And then the third is your portfolio, which, you know, we know that happened at the beginning of the semester, but the idea is to try to accumulate things for your portfolio and continue to have that portfolio that you've accumulated. And it's really about you and having a place to put all that work that you've done this year somewhere. So with that, what I'd like to suggest is that if your group would like to sit down and chat with me about your project, I think that would be the best way to do it, rather than in this big group, to have a chance just to connect. So I'm going to reach out to each group with an email to suggest, do you guys want to meet via Zoom, or do you want to come by my office? Just talk about your campus improvement project, because basically it's going to be about 2 weeks before we present them. On the 16th, I will not be here on that Monday. We have the accreditation, our accreditation body for engineering coming, not literally, but virtually coming to do our accreditation review for engineering. It's a huge thing. I've been working on it for 18 months and wrote, I think it was a 400-page cell study that we turned in this summer for it. So it's a lot of work. So that Monday, I have to do a presentation for our accreditation group about our program. So during this time. So what it means is that my hope is on the 16th is kind of your chance to be here, meeting and finalizing your projects with that as a work day. And what I might ask is, you know, if Craig is going to be here, you know, sort of being a chance to coordinate with you guys all. My hope is then to meet with you guys between now and then with your team. Okay. So I know it's a lot. And it's going to be weird because we're not going to see each other after Thanksgiving. But we'll try to get through it and make sure that you guys aren't missing anything. So if I'm missing something for you to help you out, let me know. Craig, you have anything to
Yes,
add?
the blood drive is still going on. Just a few things like that. Blood drive is still going on. There's a soccer game on the soccer field if you're looking for credit for that. And there's also a cultural event that SGA is hosting in Legacy and PR at 7 p.m. On Saturday. So you guys might want to take advantage of those things. Also, if you have any ideas that you want to run by me in regards to your project or anything that you want to talk to me about, don't be shy. Message me, text me, hit me up, stuff me, stuff idea on this. All legal is figurative. That was a joke.
So, and I'm really sorry if people were, this lecture was probably pretty hard for a lot of us. I know it was for me. We're all kind of cringing in our seats. Probably I saw it from the back. So I'm sorry if that was the case. Hopefully it didn't create permanent concerns. But with that, have a good weekend. Hope to see you guys around.